Good afternoon. I've said a couple of times this week we're going to need a bigger boat. I did not necessarily say we're going to need a bigger room, but we certainly got one of that as well. So thanks everybody for joining us, and I'm sorry we're a little bit behind. We were deliberately trying to let the White House press conference play out a little bit longer, and that started quite late, so forgive us for being a little bit behind today. Good afternoon, everybody. I want to begin by thanking Rutgers Newark for opening their doors to us on a Saturday when all the students are at home. In particular to Chancellor Nancy Cantor and the entire team here, we are deeply thankful and appreciative. I'm joined today by some folks you now at this point know well. To my immediate right, the person who literally doesn't need an introduction, Commissioner of Health Judy Persichelli. To her right, the Superintendent of the State Police, Colonel Pat Callahan. To my immediate left, the Adjutant General of the New Jersey National Guard, Jamal Beal. And to his immediate left, the Director of the Office of Homeland Security and Preparedness, Jared Maples. And to them and their teams, I thank you, and to other members of their teams who are here today, including members of the Guard, State Police, members of the Homeland Security team, as well as Commissioner of Health. I also want to give a shout out to my buddy Dante Colucci, who lost his grandmother last night, so she's in our prayers. Dante, God bless you, buddy. Lots going on, as you can imagine. Judy and Pat and Jamal will likely have comments about, among other things, testing and hospital bed capacity, in particular, in the first instance, working in partnership with FEMA. And in the second instance, working in partnership with the Army Corps of Engineers. We had our second day in the Bergen site at Bergen Community College. I think they shut down after 300 and something tests. We are limited based on the PPE, based on the supplies that we're getting from the federal side to execute these tests. But I will tell you this, there were 1,000 more people who got tested over the past couple of days than were tested at 8 a.m. yesterday morning. And that trend will continue. The Bergen site will be open again for business tomorrow morning at 8 o'clock. My guess is, and Judy and Pat and Jamal can get into this in some detail, my guess is we're looking at several hundred a day, would be my guess. We are still on track to open the PNC Bank Arts Center site on Monday morning at 8 a.m. And again, I want to give the team a huge shout out for their support there. I'm going to go swing by that on the way home after this just to look at it with my own eyes and look at the preparedness. I know Judy will give you an update, not just on her perspective on testing, but also as it relates to the ongoing deliberations with the Army Corps on reopening wings, reopening hospitals, looking at repurposing other facilities. This morning we received notification of 442 new positive test results. That brings our total to 1,327. Judy, as usual, will give more detail, particularly on the demographics and regional characterizations of those new tests, as well as 5 additional COVID-19 related deaths, which brings our total amount of deaths to 16. God rest their souls. We keep each of their memories and their families in our prayers, and please join us in that regard. Again, Judy will have more detail on both the positive testing and what that looks like, as well as some top-line information on the tragic deaths. Again, I want to reiterate something that was said from the get-go. The increase in the positive test results is completely expected. And to some extent, you've got community spread as an element here, but the overwhelming reason is our aggressive testing posture. We have been ahead of the curve on testing. It's not perfect, by the way, trust me. Nobody's patting anybody on the back here. No one's spiking any footballs. But we have been ahead of the curve on testing, and the numbers will continue to grow significantly. There's just no other way around that, and that will be many, many thousands. And again, as I know this may be counterintuitive to some, but the more data we have, the more information we have, and Judy and her team are experts at this, the more able we will be to break the back of this virus. So the more information we have, the better off we will be. Again, these numbers, as was said all along, are going to go up. We started meeting on this literally in January. I think it was Super Bowl Sunday. We put our whole of government team, we had a conference call and put our whole of government task force in place, led by Judy. We've been taking steps along the way. We mourn the tragic loss of life. Let there be no doubt about that. Each and every individual pains us deeply, and that will continue to be the case. But our job right now is several-fold. One is to expand the testing as fast as we can. Two is to break the back of that curve, flatten that curve, and I'll be addressing that in a moment, where we have taken aggressive steps and we will continue to take aggressive steps. And then finally is to expand our healthcare capacity. We know that flattening the curve will take the pressure off the healthcare system. We just can't know exactly what the timing looks like. And we are almost certainly going to be in need of every single critical care bed we can find in the state, which is why Judy and Pat and their teams are so aggressively out working with the Army Corps of Engineers to expand that capacity. Again, these numbers, the positive results, are no cause for panic, but they are a sobering reminder of the challenge we are confronting as one New Jersey family. As I've said before, while it's no time to panic, it's also no time for business as usual. And it is with these individuals, both the precious loved ones who we've lost, as well as folks who either are positive testing or will positive test, with all of that clearly in mind, that I make the following announcements. This morning, I signed an executive order directing nearly all of our 9 million residents to quite simply stay at home. As I said, we must flatten the curve and ensure residents are practicing social distancing. As I have said before, we can no longer maintain a sense of business as usual during this emergency. And again, I repeat, just as it is no time to panic, but it is time to be smart, proactive, transparent, aggressive, it is also no time for business as usual. And as we work in continued and increasing partnership with our neighboring states, in particular New York, Pennsylvania, Connecticut, and Delaware, it becomes even more vital that we all speak with one voice. We cannot run the risk of residents from one state simply moving their parties or their shopping habits across state lines. So, under this executive order, all gatherings are canceled until further notice. This means no weddings, in-person services, or even parties. This decision is not an easy one, and it pains me that important life moments will not be celebrated in the way we are accustomed to. And I know this will be disappointing to many residents. But my singular goal, our singular goal, not to mention, frankly, my job, is to make sure we get through this emergency so that you can safely gather with family and friends later and enjoy many more birthdays and weddings in the years to come. Any place people congregate is a place where coronavirus can be spread. This is no time for anyone to be acting selfishly and taking a gathering underground. But this is the time to think about your family, your friends, your neighbors, and to do the right thing. Additionally, I urge those who have homes at the Jersey Shore to not go to them at this time. The local infrastructure, especially the healthcare infrastructure, and especially in off-season, is not prepared for the influx of part-time residents. So there's absolutely no excuse for a party on the beach. Please stay at your primary residences. Further, I am directing all non-essential retail businesses to indefinitely close their physical stores to the public effective at 9 p.m. tonight. Only, and by the way, 9 p.m. in particular, out of respect of the Sabbath. Only businesses critical to our response may remain physically open to the public, and that is an increasingly limited list. Grocery stores and food banks, pharmacies, medical marijuana dispensaries, medical supply stores, gas stations, auto mechanics and repair services, convenience stores, banks and other financial institutions, hardware and home improvement stores, laundromats and dry cleaners, printing and office supply shops, pet stores, stores that sell supplies for young children, mail and delivery shops, and, as we've already noted, restaurants, liquor stores, and bars providing takeout services. Additionally, all essential state, county, and local public health, safety, and social services will remain accessible. I want to give a shout out in particular to my partner in government. We made a decision a couple of days ago to divide and conquer. I want a particular tip of the cap to Lieutenant Governor Sheila Oliver. And work at construction sites may continue, as can manufacturing, trucking, and transportation operations. That is work that largely cannot be done from home. But aside from the limited exceptions, all retail businesses must close. And all businesses, not just retail, but literally all businesses must move their employees to work from home wherever possible. Further, I signed a second executive order stating clearly that the rules I have laid out supersede all other orders issued by county or municipal officials. We cannot have a patchwork of regulations that change from one town or one county to another. And I'll repeat what I've said over the past couple of days. Folks' hearts are in the right place. That's not the question. But we have got to run this state with one set of rules, and that's what that second executive order, in fact, does. We must be on one page and reading from the same playbook as one state. Period. Now, even with this order in effect, and the main order I call the stay-at-home order. I think that's the right way to think about this. Stay at home. Even with this order in effect, life in New Jersey does not have to come to a complete standstill. Residents can still take a walk or go for a run outside. We do want people to stay healthy, both physically and mentally. But, and this is a big but, if you do go outside for these activities, or head to the grocery store or to some other essential place, we urge everyone, we are not only urging it, we're ordering everyone to continue practicing social distancing and to keep a safe 6-foot distance between you and others. We cannot have what we've seen too often in other states, again, where we tip our cap to the intentions, but we cannot see people walking right beside each other, business as usual, casually, as if nothing is going on here. So if you do go out, you must practice social distancing while you are out. Again, 6 feet is the amount of distance that is broadly recommended. But if you're not doing what I just said and going to a grocery store or a pharmacy or taking in some fresh air at all other times, and unless we need you in our response efforts, we need you to just stay at home. At a time when new COVID-19 cases continue to be identified, and they will be in the thousands, and the number of related deaths sadly continue to rise, we have to change our behaviors. As I said, from January, we've been doing everything we can to aggressively get out ahead of this. And when needed, we have adjusted our approach. And we are adjusting it meaningfully today as of 9 o'clock tonight. I said this earlier, and I want to reiterate this. We don't take these measures lightly, nor do we take them easily. We have considered very carefully every aspect of daily life. We have taken great care to ensure that we would not have to go back and revise our work. We wanted to make sure we got this right at the first go. We also recognize the impact this order will have on our small businesses, who are the backbone of our economy and the employers of the majority of New Jerseyans. We know this will only add more hurt at a time when you are already immeasurably hurting. But we must take this step to protect our residents. And we remain absolutely committed to working with you to ensure that you have the help and resources you and your employees will need going forward throughout this emergency and beyond. Employees who will be out of work should work through the Department of Labor regarding available benefits. Their best website is nj.gov/labor. Again, any worker who's out of work, the best place to go is the website nj.gov/labor. And employers who can continue to pay employees, they're urged to do so because of the benefits available through the recently passed federal response law. In other words, you're not going to get compensated for an expense that you don't have. So for many reasons, including helping our workers and their families stay afloat, please do everything you can to keep them on the payroll. This will not be the last time I mention this website today, or probably in the days and weeks ahead. But for employers, there's a good, robust page as part of a new website was set up, covid19.nj.gov. I'll come back to that in a moment. covid19.nj.gov. We encourage you to go on there. And this is something that we recognize, that employees are hurting and employers are hurting. And we accept that. We essentially, the group of us here, as well as our colleagues, we have only two choices in the broadest sense here. Number one, to let the virus run its course, to not take the steps that we're taking, and ultimately pay a huge price in fatalities and sickness, and pay an enormous economic price. That's one set of choices that has been available to us. From moment one, we have rejected that. Our job collectively is to flatten the curve, break the back of that curve as aggressively and preemptively as possible. That comes with economic pain, enormous economic pain in the here and now, both for employees and employers. But at the end of the day, we will get through this. We know that. Unequivocally, we will get through this. We'll get through this together. And because we've taken that set of choices, while the economic pain is significant now, we will save many lives. We'll keep a lot more people healthy. And frankly, at the end of the day, the economic pain related to what we're doing will be a lot less consequential than had we let this virus run amok. Those are the two choices that were before us from day one. We have unequivocally taken choice two, and we will continue to do so. That does not mean that we do not understand, appreciate, and have enormous sympathy for the pain that this is causing.